Hi, my name is Dr. Saud Anwar. I'm a physician with the specialty in lung diseases, also with critical care medicine. The people who are in the intensive care unit and the ones who are having breathing difficulties, we manage those patients. I'm also trained in occupational lung diseases. If somebody, because of their workplace, get respiratory problems, I actually help manage and understand them better. So I had my training in pulmonary medicine, critical care medicine, and occupational environmental medicine at Yale University. I also did a master's in public health at Yale University. I did my internal medicine residency training at the University of Illinois, and prior to that I was in medical school at the Aga Khan University. When they say that if one cannot breathe, nothing else matters. And one of the most important functions of our body is our breathing. And it's a thing that has a significant impact on the lives of individuals. So if a physician has the capacity to be able to use medications and their knowledge to help an individual's breathing be better, there's nothing more valuable in my mind than that. And in the same way, when somebody is critically ill, and having the tools, having the knowledge, having the understanding to be able to manage those individuals who are critically ill, it's one of the most important part of medical care. So I feel passionate. It's also a very humbling part of medical care where you can have all the tools and be able to try and make a difference, but you are at that time as close to a patient as one can be in managing their breathing or managing their blood pressure and all of the critical problems that they may have. Patients are the most and the central part of our responsibility. Having an understanding to be able to manage a patient's challenges. Now, in our current environment, it's not only medical knowledge that is going to help those patients. Having a global understanding of their surroundings, about their realistic challenges that they have in the logistical challenges of healthcare. For example, when a person has all the diseases and we can understand those diseases, but they can't afford to be on the medications, when they can't afford to have the tests, and having a global approach that is central and focused around the patient's circumstances, I think that's how we'll have to approach medical care in future. We would have to use our understanding of the disease process, but we'll also have to understand the person's realistic challenges that they have in their lives. That's part of our responsibility in healthcare, to be able to manage them patients. Now, the diseases that we are looking at in lung diseases, we actually have a mechanism, and the technology has allowed us and the science has allowed us to really do wonders nowadays for patient care, because 5, 10, 15, 20 years ago, for a number of diseases, we did not have as many options as we do nowadays. So I'm passionate because now the tools are there to be able to improve the quality and quantity of life of our patients. And that's what I'm passionate about, to be able to make that difference with the knowledge and understanding that we have. ECHN is one of the most important players who's helping manage the quality and quantity of life of the people in the community. ECHN has a great network of physicians in the community. The best thing about this is that when you pick up the phone and call your peers for any surgical or medical other specialties, you can close your eyes and be sure that they will be caring their patients the way you would care for your own family member. And that's the strength that the community network has, where everybody works in the network, but we function as a family because we know what the needs are, we know what our community needs, and we also know that our patients are the most important part of our healthcare network. And ECHN provides that. It not only helps us enhance our skills, but also makes us feel the comfort that we are making a difference every single day of our lives. As a physician, one has the capacity to understand the disease process that occurs in the person, in an individual's body. In the same way, in a community, we can understand what's going on, what are the problems people face, which has an impact on their quality of life. So I use some of those tools and that mindset to try and help out in the local community in my town of South Windsor and the neighboring towns, and then move on and help in the state as well with various levels of the work that needs to be done. And I think that's the skill that we have as physicians, and then that's the responsibility that we have, is to go beyond the individual health into the community health.